My name is Schuler. I'm going to be one of your nurses for today. Can you give me your name and date of birth?
Destiny 0301-2001.
Perfect. And any allergies?
Pentobarbital and then sulfa drugs.
Okay. And any daily medications?
No, just vitamins.
Just vitamins. Okay. So I see based on your last visit, you were discussing about some headaches. How are your headaches now?
They're still there. They're about the same.
About the same? Okay. How often are we getting these headaches?
Like twice a week.
Twice a week? Okay. Since we are having these frequent headaches, I do want to do a neuro assessment on you. And what the purpose of this neuro assessment is just to assess things like your senses, any stimuli, movement. And what this does is it kind of helps us get us a better understanding about things that could be affected or lead us to possible diagnosis. So are you able to tell me where you are and why you are here?
I'm at the doctor's office and I'm here for a follow-up appointment for my headaches.
Perfect. And do you know what today's date is?
It is April 14th, 2025.
Okay, so we are alert and oriented times 4. Alrighty, and based on some vital signs that we took prior to coming in here, your vitals look great. Your blood pressure was 116/78, heart rate was 88, respiration rate was 15, and your temperature was 98.1 orally. Next, what I'm going to assess is your vision. What I'm going to do is I'm going to assess. Give me 1 second while I turn this on. Now we have this on. So what I'm going to assess is your pupil size. I want to make sure that they are equal. And next I'm going to see if they are reactive. So I'm going to have you look forward for me. They are reactive to light. Okay. And then what I'm going to have you do is I'm going to have you look right at that sanitizer there and then look right at my finger. Okay. So look back at the sanitizer. Your pupils dilated. And then when I come here, they constrict. Perfect. And they are equal and round in size. And reactive to light, and they accommodate. Perfect. That's what we want to see. Alrighty. Okay. And next, what I'm going to have you do is I'm going to have you stick your arms out for me, and I'm going to push down on your arms. I want you to push up against my hands. Perfect. And then what I'm going to have you do, squeeze my hands. Perfect. So strength is 5 and 5 in both arms, and you have a good grip strength. What I'm going to have you do is lay down for me.
Which way do you want my feet?
Either way, it's fine. Okay, what I'm assessing here is for your posture. So we're not having any, no concerns with posture. So what I'm gonna have you do is push up against my hands here with your legs. Perfect, and now your other leg. Perfect. And then with your feet, push against my hands, and then push against my hands. Perfect. Now you can sit right back upwards. That was good. Lower extremities, you're 5 out of 5. And then I'm going to have you stick your hands out for me nice and straight. I'm just monitoring for any drifting. Perfect, you're good there. No drifting. Okay, and then next what I'm going to have you do is I'm going to have you actually either pull up your sleeves, take off your jacket, whatever's easiest for you. And I'm just going to have you close your eyes. And what I'm going to do is I'm going to tap you with an object. And you're going to tell me when you feel it and if it's sharp or if it's dull. Okay.
Dull. Sharp. Sharp. Dull.
Perfect. Alrighty, so senses are intact there. And next what I'm going to do is I'm going to assess your 12 cranial nerves. So the first one we do is our nose. So I'm going to have you close your eyes. I'm going to make you smell something, and you're going to let me know if you can smell it. Yep, that was an alcohol pad, so sense of smell is intact. And I'm now going to test your eyes, so I'm going to have you read these big words up top for me.
Glasgow Coma Scale.
Perfect, so we can see there. And then next, we already did this, but it's the reactive to light, where I shine the light into your eyes. Your eyes were good there. And then your pupils constricted when you looked up close, and then when you looked further away, they dilated. That's great. Next what I'm going to have you do is follow this with your eyes. So I'm going to go here, 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 here. Perfect. That is intact. And then next what I'm going to do is, we already did the sharp or dull, and that was good. We did the 6 fields, also great. So next what I'm gonna have you do is I'm gonna assess your facial expressions. Can you smile for me? Can you frown for me? Can you raise your eyebrows? And then can you squint your eyes? Perfect. And then can you puff up your cheeks? Perfect. So that is good. And then what I'm gonna have you do is I'm gonna assess your hearing. So I'm gonna have you close your eyes and let me know when you can hear it.
I can hear it.
Okay.
I can hear it.
Perfect. And then next, what I'm gonna have you do is just open your mouth and say ah. Perfect. And next, I'm gonna have you just swallow for me. Any discomfort or pain?
Nope.
Perfect. And that was the vagus nerve. And what I'm gonna have you do is shrug up against my hands. Perfect. And that there's just doing your accessories. And lastly, I'm just gonna have you stick your tongue out and move it to the right and to the left. Perfect. That looks great. And we're almost done to the end of the assessment. So what I'm gonna have you do is I'm gonna have you stand up. Alrighty. So what you're gonna do is you're gonna close your eyes. And what I'm assessing for is just making sure that you are kind of aware of your space. So I'm gonna have you close your eyes, I'm gonna push you, and you should be able to maintain your space where you are at. If you drift a little bit, that's fine, but you shouldn't be stumbling or falling to the floor. Alrighty. Perfect. This way. Alrighty, that looks good. So I was just seeing if you're able to regain your balance when I pushed you. Next, what I'm gonna have you do is I'm gonna have you stick your arm out. And what I'm assessing here is your antagonist muscle function. So I'm gonna push against your arm and then I'm gonna let go and it shouldn't hit you. That looks good. And then I'm gonna do the same thing on the other side. We're gonna do the same thing here. Perfect. And last thing I'm going to assess is what I'm gonna have you do is stick out your bottom hand. Top hand goes on top and you're just gonna flip like this. Alrighty, that looks good. And now we're gonna switch hands, do the same thing on the other. Perfect. So this here is just what I'm assessing is just repetitive movements if you're able to do that, which was great. Alright, and last thing I just need to go over with you, you can have a seat. I'm gonna go over the Glasgow Coma Scale, which is ranked out of 15. You're able to have a conversation with me, your vision's great, we're having good eye contact. You're able to follow all commands, so you're at a 15 out of 15, which is a perfect score, so that's good there. And that's about it. Just to reiterate, what I just did was I was assessing the nervous system just because our nervous system is responsible for a lot of things like coordination, speech, gait, communication, senses, things like that. Imbalances within this can impair how an individual like yourself can process information physically, emotionally, and it's just very important that we are able to address where any deficiencies are and if this is something that can lead us to a potential diagnosis. Alrighty, and these new areas focus on specific areas of the brain that can be impaired that are not covered in standard neuroassessments. Example, issues with the cerebellum. All three of those tests really assessed your cerebellum function. And everything was good. So do you have any questions?
Don't think so.
Alrighty, well, that is it.